Welcome to ABC tutorial. Today we are going to talk about antepartum hemorrhage. Antepartum hemorrhage can be broken down into ante meaning before, partum meaning birth, and hemorrhage meaning bleeding. So literally, antepartum hemorrhage is bleeding that occurs before delivery. It is defined as bleeding from the genital tract after the age of viability and before the onset of labor. The prevalence of antepartum hemorrhage is about 0.5 to 5%, with higher ratios occurring in developing countries. The bleeding could be from placental, fetal, or maternal origin. The placenta causes include placenta previa, in which case the placenta attaches partially or totally into the lower uterine segment. Placenta abruption, which is the premature separation of a normally situated placenta. Fetal etiology include vasa previa, which is bleeding from the fetal blood vessels. Maternal causes could be as a result of trauma, cervical ectropion, cervical carcinoma, vaginal infection, cervicitis, passage of excessive show, and sometimes the etiology could be idiopathic. Features of antepartum hemorrhage include bleeding, which may be accompanied by pain, especially in cases of placenta abruption, or sometimes it could be painless in cases of placenta previa. Weakness, reduced fetal movement, abnormal presentation of the fetus, and also there may be associated signs of fetal distress. There could be maternal and fetal complications of antepartum hemorrhage. Maternal complications include shock, postpartum hemorrhage, sepsis, disseminated intravascular coagulopathy or DIC, acute renal failure, resuscitation, and maternal death. Fetal complications include fetal distress, intrauterine growth restriction, umbilical cord accidents, and death. Management of antepartum hemorrhage depends on the etiology. Basic investigations done include complete blood count, hemoglobin electrophoresis, urinalysis, ultrasound scan, and fetal cardiotocography. Treatment includes bed rest, administration of oxygen, blood transfusion, delivery of the fetus either by vaginal delivery or cesarean section.